Foundations of asthma. Definition. Asthma is a chronic inflammatory disorder of the airways characterized by variable airflow limitation and bronchial hyperresponsiveness. Key features: reversible airflow obstruction, airway inflammation, and remodeling over time. Epidemiology. Global prevalence, 300 million people. Affects all ages, more common in children. Higher rates in urban areas, but severity may be greater in low-resource settings. Mortality is low, but preventable. Pathophysiology. Chronic airway inflammation involving eosinophils, mast cells, and T helper 2, Th2 lymphocytes. Inflammatory mediators, e.g. histamine leukotrienes, cause bronchoconstriction, mucus hypersecretion, and airway edema. Remodeling. Thickened basement membrane, smooth muscle hypertrophy. Infographic idea. Cross-section of a normal versus asthmatic airway, narrow lumen. Inflamed mucosa, mucus plugs. Immune mechanism diagram. Allergen dendritic cell, Th2 cell IL, 4 IL, 5 IL, 13 eosinophils. EGA production, mast cell degranulation. Module 2, etiology and risk factors. Environmental triggers. Allergens, dust mites, pollen, animal dander. Air pollutants, occupational exposures, tobacco smoke. Genetic predisposition. Family history atopy, certain genetic polymorphisms in IL, for /IL-13 pathways. Lifestyle influences. Obesity, diet low in antioxidants, sedentary habits. Case scenarios. Child, 7-year-old with nighttime cough after playing with neighbor's cat. Adult, 35-year-old factory worker with worsening wheeze during weekdays, better on weekends. Elderly, 70-year-old with late-onset asthma after moving to a polluted city. Module 3, clinical features and diagnostics. Symptoms: wheezing, especially expiratory, cough, often nocturnal, chest tightness, shortness of breath. Episodic, variable, triggered by allergens, cold air, exercise. Diagnostics: spirometry, FEV/VC ratio 0.75 to 0.80, reversible by greater than or equal to 12% and greater than or equal to 200 milliliters post-bronchodilator. Peak expiratory flow, PF, monitoring for variability. FeNO, marker of eosinophilic inflammation. Flow volume loop, concave expiratory curve in asthma. Insert diagrams of spirometry traces and flow volume loops. Module 4, management and treatment aligned with GINA. Stepwise pharmacologic treatment. As needed, low-dose ICS formoterol. Low-dose ICS daily or as needed. Low-dose ICS /LABA. Medium/high-dose ICS/LABA. Add-on biologics, omalizumab, mepolizumab, dupilumab. Non-pharmacologic, trigger avoidance, vaccinations, smoking cessation. Practical, inhaler technique demonstration, MDI with spacer DPI. Case study, moderate asthma, step 3 therapy. Severe asthma, step 4/5 plus biologic evaluation. Module 5, acute exacerbations and special populations. Recognition and classification. Mild, moderate, severe, life-threatening, based on speech, respiratory rate, PF, oxygen saturation. Management. Oxygen to keep SpO2 greater than or equal to 94%. Inhaled SABA, e.g. salbutamol, plus or minus ipratropium. Oral corticosteroids, prednisolone 40 to 50 milligrams for 5 days. For magnesium sulfate in severe cases. Special populations. Pediatrics, weight-based dosing, education for caregivers. Geriatrics, comorbid COPD, polypharmacy, inhaler dexterity issues. Module 6, self-management and comorbidities. Asthma action plan, personalized color-coded zones, green/yellow/red. Comorbidities, allergic rhinitis, nasal steroids. GERD, lifestyle modification, PPIs if symptomatic. Obesity, weight reduction. Module 7, advances and summary. Emerging treatments. Biologics targeting IL-5, IL for /IL-13. Personalized medicine with biomarker-driven therapy. Digital monitoring devices. Wrap-up quiz. 10 MCQs covering all modules. Optional. Downloadable certificate upon completion. I can create a clean, one-page infographic on asthma pathophysiology, a spirometry and flow volume loop diagram set from Module 3, a color-coded asthma action plan template from Module 6, a short slide deck for inhaler technique demonstration,